Hi everyone, we are the doctors Bjorkman, a physician couple going through pregnancy ourselves for the very first time, sharing with you all our medical expertise and our real life experiences along the way.
This week we are going to cover a question I had myself, so stay tuned as we find out together everything that your pediatrician wants you to know when you are taking home baby for the first time.
Yeah, and in case you've never met us before, I'm Kurt, I'm a pediatrician.
I'm Sarah, I'm an OBGYN and I am 25 weeks pregnant.
And we are the doctors Bjorkman.
So this week we were sitting having dinner and I kind of realized how little I really know about what you need to know about bringing home a new baby. I just deliver them. And I said to Kurt, I said, do they even have diapers at the hospital for the baby or do you need to take them? Like what do we need to be doing?
And so with that, this week we're going to dive into all the things that I as a board certified pediatrician want parents to know about taking home and caring for a brand new baby. So the first thing parents need to know is that babies eat a lot. You can expect your baby to be eating at least 8 to 12 times a day, and that comes out to at least every 3 hours. And so in the pediatrics world, we say we gauge feedings on from the time of the beginning of one feed to the next, and we say babies are going to feed at least every 3 hours, usually on average. It is very normal for babies to have cluster feedings where they may feed and then feed again and then feed again, but it is safe to assume that as new parents you're going to be very busy with baby just from a feeding standpoint.
And I have heard that from a lot of my friends who have just recently had babies, just that you're going to be surprised how much time you actually spend feeding the baby in those first few weeks. It's just all day you feed the baby.
Yep. And so one of the things that the pediatrician is going to do at each day in the hospital before you go home, and then at checkups when you come back a couple days later, then at a 2-week visit, is they're going to see how well baby's feeding by measuring their weight. But you may say, hey, you know what, I don't have a scale at home. How do I know baby's getting enough? And a good way you can know baby's getting enough to eat is by how much is coming out. And so with that, just as much as they're eating, you're going to expect that they're going to be peeing and pooping a lot too. So we like to say babies should have a wet diaper or pee at least 3 times a day, but oftentimes babies may pee with every feeding too. And then with that too, they're going to poop a lot too. And so in those first couple of days, that poop is going to be kind of this black, tarry, meconium looking stuff, but over the course of the first few days it's going to thin out. It's going to go to green and then to yellow. If they're breastfed babies, they usually looks a little seedy, like there's mustard seeds in it. It's not what they are, it's just kind of the texture of the digested breast milk. They're formula fed, it's sometimes maybe a little thicker, but usually we say, day 1 they have 1 poop, day 2 they have 2 poops. By the time they're 4 days old, they're having 4 poops a day, sometimes with every feeding just the same.
And I would say, poor Kurt on this one of the most common questions that Kurt has gotten from my friends is my baby's poop normal? And they will send me pictures of their baby's diapers full of poop or come show him at the hospital, is this normal? So it is very normal to be wondering, having those questions, and so you can refer back to this of kind of what to expect it to look like in those first few days. It's going to change a lot.
Yeah, and you might see all colors of things in your baby's diapers. The things that I like to say is yellow is fine, green is fine, brown is fine, black in those first couple days is fine. Things that would maybe alarm me as a pediatrician or like make me look into it further would be if the poop was white, or if you thought you saw like actual blood in the poop. I think another thing that sometimes parents wonder about is just babies straining. This is a brand new thing for them, and so you may say like, babies are just look like they're straining to poop. A lot of this is just kind of their normal way of learning their bowels, and as long as those poops are soft, then you don't have to worry so much about constipation. As babies get a little older, they may start to poop once a day or every other day, and as long as they aren't having pain with that or firm balls of poop, then you know that they're in a pretty good spot with that. The next thing I like to talk about is sleep. And sleep is incredibly important and actually can be a dangerous time for baby because it's the time when they are not being observed as opposed to when they're awake and they're always in someone's arms or being watched. And so the most important thing is that baby sleeps on their back. Okay, we say an empty crib, swaddled just in one blanket around maybe one layer of clothes on their back to sleep.
And this was what, one I wasn't 100% sure of is, what about the bumpers, like the really cute bumpers for the crib?
Yeah, and so we say no bumpers, no extra blankets, no toys in the crib. And the biggest reason for this is a young baby who isn't able to protect their own face or roll over on their own. We would hate to have them have something in front of their face that would impede them from taking kind of normal breaths with that and be a potential risk for sudden infant death syndrome. So we realize this maybe sounds kind of overcautious, but this is a very real risk that we know that if we have babies on their backs to sleep in an empty crib, that is the safest way for baby to sleep.
Can I ever put the bumpers in her crib?
Yeah, so once babies are able to roll themselves over and they're able to kind of take care of themselves, you could think about having bumpers in the crib. But again, the biggest thing is for newborn infants, empty crib on their backs to sleep.
It's just so cute, but safe baby is more important.
The next thing I like to talk to parents about is just caring for the umbilical cord. So you may ask, gosh, like there's this stump of tissue here at the belly button site. What do I do with it? It looks nasty, it looks gross.
Yeah.
There's all sorts of old practices with that. The best thing to do is to leave it alone. You don't need to wipe it with alcohol, you don't need to clean it. The goal is to let it dry out, and it usually falls off in the first week of life. You may notice a couple little drops of blood at the time, but that's about it, and that should be it. After that, you can start bathing the baby, but before that, we usually just say sponge bathing to try to keep that area dry.
So you said leave it alone, keep it dry, you don't need to do anything, but what am I looking out for that would be not good?
Yeah, so there are some rare complications that can come up with the belly button. The only reason that I as a pediatrician would want to hear from you about it is if you thought it was really red or angry looking or looked swollen around the belly button site. There are some rare infections that can happen in this area, or even if you thought there was persistent drainage, sometimes that's a little thing that can happen that your pediatrician will be able to help you troubleshoot and take care of if it's an issue at all.
Does it go like above the diaper, or is it in the diaper? Does it matter if it touches the diaper?
I usually say if you can keep the belly button exposed, it just helps it dry out and fall off and do its normal process a little bit faster rather than keeping it covered where it might stay moist and get kind of goopy and gross.
Okay.
That which leads us to talking about things in the diaper area. So lots of questions about boy parts, girl parts for young babies. So for little girls especially, it's very normal for them to have some sort of vaginal discharge. White discharge is normal. You may even see some bleeding in the first couple of days, and a lot of this is just a response to mom's hormones as that young baby girl is now transitioning to the world outside of mom. For baby boys, it's a little different. It all depends on whether the boys had a circumcision or not. In terms of circumcision care, one of the best things you can do is really leave it alone. We do say to put Vaseline on it is a good way to keep that tissue protected, keep it from sticking to the diaper, and to keep poop off of it. These are good things to keep it both clean and to keep it from adhering that can cause pain. Usually in the first 5 to 7 days, that skin will kind of transform and heal and then no longer be an issue. For babies who aren't circumcised, get questions about this all the time. It is best to leave the foreskin alone. You don't need to retract it or anything. That is something that will happen over the first couple of years of the baby's life. And so if baby's not circumcised, you can definitely clean the penis, but don't try to expose the head of the penis at all, as that can do more harm than good for young babies. Let's see, what's next? Car seats are incredibly important as something that you must have to bring baby home from the hospital.
It's one of the few things that you have to have for you to be able to walk out of the hospital with your baby.
Yeah, to answer Sarah's question that she had at the dinner table earlier this week, you don't need diapers at the hospital, you don't need formula, you don't need bottles. And so the one thing you do need to bring is a car seat. And then it's also a good idea to bring an outfit for baby to go home, but even if you don't, they will have little special baby shirts and swaddle wraps and baby hats at the hospital. If all you brought was the car seat, you'd be okay.
So I just want to kind of reassure you and encourage you that if you feel like you're a little lost or don't know a lot of these things, that's okay. I'm an OBGYN. I've delivered hundreds of babies, and I didn't know this stuff. I thankfully have a pediatrician on hand who can help, but there's a learning curve for everybody, and there's going to be a learning curve when we bring this little baby home, and so much of this is learning as you go. You know, like, what kind of bottle should you use if you have a breastfed baby? Like, I learned this week you're supposed to boil these suckers for 5 minutes before you actually use them. So you're not alone. We are here to help you. There's tons of great educational content coming for you, so just stay tuned.
And so important things about a car seat is to make sure that it is not expired. They do have a lifespan after so much time. They are considered too old to be guaranteed safe for baby. And then to make sure it's secured in the car correctly. Okay. The biggest thing is that this car seat needs to be facing backwards for a newborn infant. Okay. And then make sure to look at the manual that comes with the car seat to make sure that it's installed properly. If you have questions about this at all, you can always ask at the hospital, and they can come down and check your car seat to make sure that it's installed properly, because everyone wants your baby to be safe. Other quick pointers and tips that we're going to probably try to talk about in a future episode is just to make sure that the shoulders are at the lowest setting, the shoulder straps. Okay. You shouldn't be able to pinch the strap. They should be tight enough to where you can't pinch and fold the straps down on themselves. Okay, that's how you know it, baby's snug enough. Okay. Other good things is that baby should just be kind of in one layer. If it's cold out, blankets or snowsuit should be outside of the straps.
Of clothing. One layer of clothing.
Yes.
Okay.
And the big thing there is that if baby's got a lot of clothing on and then you strap them in, if they were to get an accident, that clothing or that bedding or whatever can compress and baby could potentially slip out. So just kind of one layer of clothing, then strap them in. If they need extra things to stay warm in the car, put it over the top of their straps and keep their little faces out and exposed.
Got it. So car seats are that one thing that maybe a hand-me-down isn't going to work for because they expire, and it's that one thing we really need to get.
Yeah. Another question we get asked about all the time is, how do you keep baby healthy, and when do I need to call a pediatrician? And so the best things that you can do for baby is to keep everyone around them healthy, okay? Their immune systems are still young, still developing, so it's really important. Lots of hand washing for anyone who's gonna be around the baby, holding the baby. Definitely in the era of COVID, this changes things a little bit. Yeah. It doesn't mean everyone's got a mask around, and so if you have people coming in to see baby and you wanna say, hey, could you wear a mask around baby? That is okay for you as parents to ask. Again, that's something that you can weigh the benefits of. We say to try to avoid large crowds, but if there's a bunch of people that want to come see baby and you want to say, hey, can you please wear a mask around my baby? You as parents can absolutely say that. I wouldn't say you have to say that, but just something that is an extra thing that we have in 2021 that we didn't have easily available to us pre-COVID era.
Yeah, it used to be just, if you want to hold the baby, you need to wash your hands. But now it's kind of, if you want to hold the baby, you need to wash your hands. Have you gotten the vaccine? Will you wear a mask? It's just another layer of things to think about.
And then the other part of that is we talk about cocooning baby with vaccines. So making sure that everyone who's going to be around the baby is up to date with their pertussis vaccine. So this is the whooping cough. Whooping cough for you and me could be kind of just an annoying cough that lasts a couple of weeks. For babies, it could mean life or death. And so this means making sure dad is up to date, making sure grandma and grandpa and anyone else who's going to be up to date has had that Tdap vaccine. That P, letter P, and Tdap is pertussis, and making sure that baby is safe from that standpoint.
Yeah, moms get vaccinated usually in the 3rd trimester, so they pass some immunity on to baby, and moms do that in each pregnancy. Everybody else in the family just needs to make sure you are up to date, which is usually 5 to 10 years. Every 5 to 10 you need a booster.
Yeah. And so the other part of that is like, gosh, when is baby sick? When do I need to call? And so you absolutely 100% do not need to regularly check your baby's temperature. But if you say, hey, you know what, my baby seems off, they've missed 2 feeds, they're extra sleepy, they feel really warm to me, those are good times to check baby's temperature. And I would say anytime their temperature is greater than 100 degrees Fahrenheit, to give your pediatrician a call. So it's a nice, easy number to remember. And this usually lasts for the first 2 months of life, where we're extra cautious with young babies and fevers, just as their immune system is still developing. The best way and most accurate place to check a baby's temperature is actually rectally. If you are, for whatever reason, uncomfortable with that, that's okay. The second best place that we like to recommend is under the arm.
Okay, that
Good.
seems, yes.
Okay. Another good reason to call the pediatrician would be if babies' wet diapers have really dropped off. So again, we said they should have at least 3 wet diapers a day, peeing at least 3 times a day. If they're having less than that, that would be a sign that, hey, maybe they're not getting enough to eat, they're dehydrated, something else might be going on. So that's another nice rule of thumb to keep in mind for that.
Okay.
The final thing that I like to talk to all new families about, new parents, is just about kind of mental well-being. You guys are going to take home a new human being. Mom has just given birth and done an amazing thing.
But it's really hard.
It's really hard.
Physically challenging and exhausting. Yep.
And this newborn period can be really tough. And so a couple of things is it is normal to feel like your mood is a little off.
Yep.
But if there are big changes, if you say, gosh, I'm having trouble connecting with my baby, I feel really sad, I have thoughts of harming myself or baby, please do not hesitate. Pick up the phone, call your pediatrician,
Call your OBGYN. Yep.
And let us know. There's definitely a difference between baby blues and postpartum depression, and either of those, us as pediatricians or as OBGYNs, we want to help young families, young mothers get through this.
Yep.
And the other thing is that babies can be really demanding, and they can cry for what seems like an unending amount of time.
They're so needy.
Yeah. And so if you are ever in a spot where you say, gosh, I am so fed up with my baby, it is okay to swaddle them up, put them in their bassinet or their crib on their back with nothing else in it, and take 5 minutes for yourself.
Yep.
You can leave baby to cry for 5 minutes while you go take a mental moment for you to just regroup and then come back and love that baby with a fresh mind and a fresh spirit and start all over when everything else seems to be going haywire. So.
I mean, one of my attendings talks about how with that first new baby crying, kind of losing her mind, she said, I understand how shaken baby happens. And she's a physician, an OBGYN, and just thought she was going to lose it. And so it's better to just put your baby down in a safe place, walk away for 5 minutes, take a deep breath, and come back ready to be a mom or dad.
That's it for us this week, guys. Thank you so much for tuning in. Please let us know if you have any questions in the comments below. Also know that your pediatricians, your family care doctors, your primary care physicians, and providers love to hear from you when you have questions.
Yep.
Write them down. Bring them to your next visit with baby.
And we have lots of great things coming up for you to answer some of those last questions to get ready for this baby. Breast and bottle feeding, what to expect in the hospital with that new baby, what to expect in labor and delivery for mom, different things we'll talk about, epidurals and pain control and C-sections, and great things coming up for you guys in the coming weeks. So like you said, make sure you're subscribed so you don't miss any of it. We love having you all here, and we will see you next week.
Thanks for joining us, guys. Bye. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.